Hi everyone, a very good afternoon to all of you. Welcome to this recall session of psychiatry of the FMG exam which occurred yesterday. I hope the exam went really well, and again of course it's the time to relax yourself, and in this recall session we'll try to see what all questions were asked. We'll try to get as much information as we can, so that again it will be useful for the students who will be appearing later on for the future FMG exams. So again, from the topics which we could gather, again we are seeing this trend that again around 10 or 10 plus questions from psychiatry they are asking, and this time also we could get around 12-13 questions from psychiatry. So we'll talk about these questions, and again thank you everyone, you've been giving your input about the questions, about the options as well, and this time also just see if there are any changes, do let me know. So let's start with the first question. Now this is a question which we are always discussing, and we are expecting such questions from the basics, from the MSc. Now I hope this was a relatively easier question, and overall in fact if you ask me, the questions of psychiatry I would say they were moderate to towards easier side. Let's see this question and tell me, this was the exact question. A person thinks somebody wants to kill him and he cannot be convinced or explained. So again it's a false, fixed, firm belief or idea. What is this? What we call that? So we have talked about this. This is delusion. So in the option they have given hallucination, illusion, delusion, obsession. So we know hallucinations, illusion, these are disorders of perception. Obsession, we know it's an abnormality of possession of thought. So here the answer is option C. And which delusion it is? Sometimes they have also asked this. So of course we know that here the person thinks somebody wants to kill me. So it is delusion of persecution. We have discussed this even in the RR session, even in the LRR session which we had taken. Let's see the next question. Now just let me know the second question. This was the language. These were the options. Also please try to help me with the options, so that when we are putting the final questions in the app, we are able to get as close as possible to the exam question. See, this is the topic. Again we have talked about this even in the RR, LRR session as well, of course in the main videos as well. A 29-year-old female, for her persistent low mood she's having, doesn't feel like doing anything, sleeps 15 hours a day. So in the sleep they have given the sleep is increased, there is hypersomnia, limbs feel heavy, so they have given laden paralysis. Let me know if all these terms or all these symptoms are mentioned. Also she is eating a lot for 2 months. So they have also given there is increase in appetite. And also see this, she feels happy when hears her mother is coming to visit her in 2 weeks. So what is this? This is mood reactivity. So what is this? We've talked about specifiers of depression. Again very important, they have been asking. In fact we have discussed this in the main video. Also when we're talking about in LRR, in this question also we have talked about atypical depression. And I've given you a trick to remember the symptoms of atypical depression. See, so it is atypical, so symptoms are not typically seen in depression. So the mnemonic which I've given you, we can remember it like this, that in depression the will is low. So in atypical depression the mnemonic is my will high. Okay, yes, mood reactivity is there, W for weight gain, interpersonal rejection sensitivity is there, the person is very sensitive to events, laden paralysis, patient feels as if my limbs are heavy, they are laden with something, and H for remember hypersomnia. So I hope all of you were able to mark this answer correctly. So the right answer here is, that is MDD, major depressive disorder. Here the person is having atypical feature. So this is atypical depression. I hope all of you are able to solve this question. Now let's see the next question. Now see this question and let me know if this was the question. The student said that the question is, the patient presents with as shown in the image. So they had given an image of rabbit. So they are trying to tell you rabbit like perioral movements are there, rabbit syndrome on long-term treatment. So person is on a long-term treatment and present with such symptoms. So you have to tell me the drug. Just see whether these were the options in the question. So the options are risperidone, which is a second generation antipsychotic, clozapine. It is a second generation, but we have learned that it has less EPS. Ziprasidone, again it's a second generation, and fluoxetine, which is a SSRI. So here basically they are trying to talk about EPS, extrapyramidal symptoms. Now see this, we have talked about this in the extrapyramidal symptoms. Yes, so chlorpromazine also was there in the option. Chlorpromazine was also in the option. Okay, was haloperidol in the option? Yes or no? Some students said, sir, haloperidol was there instead of risperidone, there was haloperidol. Some students have said that, sir, it was haloperidol. So let me know if risperidone was mentioned or haloperidol was mentioned. Okay. Right. So haloperidol was not mentioned. Okay. So the risperidone drug was mentioned. So see this, we have talked about this drug induced Parkinsonism. In fact, we have learned the mnemonic of EPS with this mnemonic DP at night, right? So perioral movements or rabbit syndrome, you can see these perioral tremors, they usually occur later in the treatment, as they have mentioned in the question as well. So the right answer is here option risperidone. So please remember risperidone. If haloperidol was mentioned, that would have been the answer. But students said, sir, one option was mentioned, and many students said, sir, it was risperidone. Yes, risperidone was there. So right answer here is risperidone. I hope this is clear to everyone. Everybody was able to mark this answer. It's a second generation antipsychotic, but we have discussed that out of the second generation, risperidone is one of the drugs which has EPS, high EPS, right? Yes, very good. So I am happy that you are able to solve these questions. Let's see the next question now. Now again, a relatively easier question. This topic they have asked again and again. A patient is given 5 milligram IV morphine. So what is morphine? It is an opioid. Always in the question, try to see what drug they are mentioning for post-operative pain management, and you are monitoring him for opioid toxicity. Which of the following findings can suggest morphine overdose? Very good. So the right answer is, let me know if these were the options: tachycardia, dilated pupils, tachypnea and bradypnea. So we have talked about opioid intoxication even in LRR also and RR as well, that there is a clinical triad of respiratory depression. Remember, there is pinpoint pupil and patient may even have coma. So yes, the answer is option D. And also remember, so many times they have asked the management also. In the management we use IV naloxone, opioid antagonist, short acting opioid antagonist is used in the management. I hope all of you were able to answer this question, right? Yes, very good. Now let's see the next question. Okay, so yes, so one was dilated pupil, unequal pupil again. So okay, if you see unequal pupil was one of the options. Thank you for this update. Yes, so then again we'll go with bradypnea. Okay, so we know there is pinpoint pupil seen. Okay, I hope this is clear to everyone. So these were the options. Okay, tachycardia was not in the option, right? So I'll remove this. Great. So thank you so much for helping me out with the options, so that when we are putting the final version, we'll try to modify the questions as per your information. Now let's see this question. I hope all of you were able to solve this question. Let's see this question. A 45-year-old man with a history of chronic alcoholism has been abstinent for the last 3 months while on de-addiction therapy. So he's on some treatment. He consumed 60 ml of alcohol at a social gathering. So he consumed alcohol while he's on treatment. Within 15-20 minutes, he developed nausea, vomiting, rashes, throbbing headache, palpitations. Which of the following drug was he on for alcohol dependence? I hope, very good, yes. So I hope all of you were able to answer this question. This is disulfiram ethanol reaction. So we know that disulfiram, it inhibits this enzyme aldehyde dehydrogenase. So disulfiram is a drug. Previously also they have asked many questions. A few years back a lot of questions have been asked on disulfiram. This question was asked that disulfiram, it's a aversive agent. So we know it inhibits the enzyme aldehyde dehydrogenase. See this. So it is inhibiting this enzyme. So person is taking disulfiram, and while he is taking disulfiram, we have inhibited this enzyme, he consumes alcohol. And when he consumes alcohol, alcohol is converted to acetaldehyde, and subsequently no further reaction is going on. So there is increase of acetaldehyde, and we have discussed this. Increase of acetaldehyde is again toxic. It produces unpleasant symptom, and that is known as disulfiram alcohol or disulfiram ethanol reaction. So patient may present with nausea, vomiting, flushing is there. So all those symptoms patient has developed. So I hope all of you were able to mark this question correctly, right? So let's see the next question. Again, this is a direct question which we have been discussing again and again. So you will see a lot of questions we have talked about even in the LRR session. See this question: an elderly patient diagnosed with dementia. So diagnosis of dementia is there, and she is on drug Memantine. What is the mechanism of Memantine? So we have talked about this. Dementia is a very important topic. They have asked questions on management, and even we'll discuss one question, a question on diagnosis was also asked. So tell me, what was the answer? Yes. So we have discussed, I always say correlate the etiology with the mechanism of action of drugs. So with this we have talked about this, that there is decrease of acetylcholine, in dementia like Alzheimer's disease. So we'll use drugs like cholinesterase inhibitor. We've also discussed that there is increase of glutamate. So we are using NMDA antagonist. NMDA, it's a glutamate receptor. So we are using the drug mementin, which is a NMDA blocker. So also they've mentioned, okay, so inhibit amyloid beta, that was also given. So also in fact, remember that we have a newer, drug which is having a different mechanism, that is monoclonal antibody. So we have in fact, remember the name as well, remember it is used for Alzheimer's disease especially. So these monoclonal antibodies, they go and bind the A beta deposits. So remember aducanumab, lecanemab and donanemab. But this time the question which was asked was on NMDA blocker, that is mementin. I hope all of you were able to answer this question. A very good afternoon to everyone. I hope this was fine. The question and the option, please also let me know if there is any correction in the other options. Okay. Now let's see the next question. Great. Let's see this question now. Again, this is a question which we have discussed in the main video. Also, when talking about the LRI, we have discussed that paraphilias again is a topic which they are asking again and again. A person gets sexual gratification by wearing clothes of opposite gender. So he is getting sexual gratification by wearing clothes of opposite gender. So you have to tell me which of the following paraphilias is it. I hope this is very good. So we know transvestism is also known as eonism. Very good. In fetishism, we know the person is getting sexual gratification from other objects or non-genital body parts of the person. Voyeurism, O is coming. So remember, he is getting sexual gratification by observing other people in intimate behavior or activity. Exhibitionism, he is exhibiting his genitals and getting sexual gratification. So please remember transvestism. Trans means opposite, vestism clothes. So trans, wearing clothes of opposite gender, person is getting sexual gratification. Previously it was known as transvestic fetishism. Okay, also known as eonism. So again, this is a topic which they have been asking again and again. So paraphilias, usually they ask questions like this. Let's discuss the next question. I hope this is clear to everyone. Up till now, any changes in the questions which we have discussed? Right. Let's see the next question. Again, lithium we have been discussing again and again, a very important topic. Now, which of the following ECG change is most likely to be associated with lithium therapy? So just see this question and let me know if these were the options. So what is the right answer? Tell me what is the right answer here. In fact, we have discussed lithium in detail as well in the main videos. So we have talked about the effects of lithium with this mnemonic lithium only. And in M, we have discussed certain miscellaneous effects of lithium, like it can cause weight gain. Also remember, we have talked about that it can also cause ECG changes. So T wave changes can occur, such as flattering or inversion of T wave. In fact, it is contraindicated in sick sinus syndrome because it decreases the sinus node activity. Right? I hope this is clear to everyone. So what is the right answer here? The right answer is T wave inversion. I hope this is clear to everyone. Great. I hope this is clear to everyone. So you will see the topics are getting repeated. Of course, they're framing newer questions, but you will see that the topics are getting repeated. Let's discuss the next question. Now please see this question, and we have discussed this topic in all our videos. Let me know if this was the question and these were the options. An elderly woman is brought to psychiatry OPD by her daughter, and there is complaint of forgetfulness. For the past 1 year, she has been seeing people and animals in nearby house that have been unoccupied during this period. So again, here we are seeing that person is having cognitive impairment. There is loss of memory. So memory impairment they are mentioning. They are also mentioning what is this. So they are also telling you that there is visual hallucination. Okay, frontotemporal dementia was one of the options. Thank you. Was vascular dementia there? Okay. Also, there is rigidity. What is the most likely diagnosis? Very good. Chalo, I am very happy you remember Lewy body disease. We have discussed this, that there are core features. In fact, we have talked about this, that we'll remember it with the mnemonic CVMR. So there is cognitive impairment. V for visual hallucination, very important. Motor features again mentioned, and also we have discussed this. FQ also may come as a newer question later on. REM, sleep behavior disorder, is also now considered as the core feature. Yes. So vascular was present. So let me know which was not present. Both Lewy body disease and Parkinson disease, both were mentioned in the question. Just let me know if that is there. Let me know if that is correct, but both were mentioned. Dekho, we have also discussed this, that Lewy body disease and Parkinson disease dementia, they are close differential diagnosis of each other. And we have talked about how to differentiate. Clinically we can differentiate because we know in Parkinson disease it will be motor symptoms which will start first, but here as you can see the history which they are giving more suggestive of that there is a lot of cognitive symptoms and gradually other symptoms are also present. Okay, Alzheimer's was not in the option. Okay, thank you so much. So Alzheimer was not in the option. So again this topic they have been asking again and again in FMG, NEET PG, again and again they are asking question on Lewy body disease. So finally again this question came. So the answer is Lewy body dementia. I hope this is clear to everyone. Very good. Let's see this next question. Now please help me out with the question, with the language of the question and the option. A patient is getting irritated, having fluctuations of emotions. He reports of hearing voices talking about his actions. He has poor eye contact and with the people and wants to stay alone. These symptoms they are present for more than 2 months. Which of the following is pointing towards the diagnosis of schizophrenia and not delusional disorder? Was this the question? They are asking you to differentiate schizophrenia from delusional disorder. So we know both are psychotic disorders, and in fact we have learned this, that to make a diagnosis of schizophrenia we have used this mnemonic, the name of the movie Dhadkan. So delusions, hallucination, disorganized speech, catatonic symptoms, negative symptoms, and to make the diagnosis 2 or more symptoms should be present. Now duration wise of course we have discussed that there is some differences, like duration of schizophrenia in DSM is 6 months, in ICD we have learned that it is ICD-11 it is 1 month. Now see this, how will you differentiate schizophrenia from delusional disorder? So we know in delusional disorder patient has only delusions, 1 or more delusions, which may be related, may be unrelated. While in schizophrenia if a person has only delusion will not make a diagnosis. So it should be 2 or more symptoms. So you have to see. Okay, the duration you are saying it was 1 month. Okay, we will make it 1 month duration. Thank you. They asked which other delusional disorder you will add to make schizophrenia diagnosis. Okay, it was a teenage, the age they have given teenage. So there is few more teenage. Yes, of course. See, how will you differentiate? Of course, emotional or problem or depression, that will not help you differentiate the two. Delusion of persecution, it can be seen in both, isn't it? Also symptoms for more than, you are saying it is 1 month. Okay, please remember just the duration will not help you differentiate between the two. Very important is yes. So if the patient has hallucination, okay, so if the hallucination is present, then of course you will not make a diagnosis of delusional disorder. In delusional disorder we have learned that hallucinations are absent, or if they are present they are very transient, they are not prominent. If they are prominent then you will think of some other psychotic disorder like schizophrenia or acute psychosis. That would depend on the duration. So I hope this is clear to everyone, right? So this was the question and these were the options. It's a very a good question. This is the type of question they are framing, but if we understand the basics I am sure we can answer these questions. Yes, in fact I am getting more than 10. Yes, so they are, as we are seeing, a lot of questions from psychiatry are being asked, nearly 10-12 questions they are asking in the exam. So one has to be very careful, and also you will see a lot of basic questions are asked. If you understand the basic you will be able to solve the question. Let's see this question now. Now please help me out with this question. See if this was the question and these were the options. A young boy, bright in studies, securing good grades in class, now has poor performance. So there is deterioration of his academic performance. Parents notice change in behavior. So they are also noticing change in behavior, like he is avoiding speaking to others and often he is coming late home in the night. Right. So tell me, what are you thinking? So if such question comes, always try to rule out the options. He is avoiding eye contact. Okay, he is avoiding eye contact. That is also mentioned as you are saying. He is angry. There is anger you are saying. Okay, so one question of LSD also. So this I have not got till now. So we'll discuss about this question on LSD also. Okay, rebellion. Autism was also given. Yes, autism also I got from some students. Yes, autism was there. Normal teenage behavior was one of the options. So it is not normal teenage. Okay, it was normal teenage behavior. So again, but coming late in the night, this may tell us. See, personality disorder, was that in the option? So generally personality disorder will not make a diagnosis at such a young age, and of course we require time. The symptoms are present for a longer time to call it as personality disorder. So see some of the changes, like he is coming late at home. This is so symptoms of depression, mania, not characteristically they have mentioned here. Okay, recent drug use can be one of the possible answers, but please see the options and let me know if these were the options. Okay, it is if normal teenage behavior was one of the options, that is not the answer. Okay, so LSD we have discussed, better so many symptoms we have discussed. It's a hallucinogen. Let me know what were the symptoms which they have mentioned. So from these options which we can gather, the better answer would be, because he's showing certain behaviors, because the recent drug use, he may be having some of these symptoms. I hope this is clear to everyone. Right, so I've gathered the options. Yes, so let me know. Yes, these were the options. Right, let's move on. In fact, we've talked about this in dependence on the substance dependence. There is neglect, progressive neglect of alternate pleasures, interests. So person is spending more time in consuming substance and maybe neglecting some of the other activities. Right, now let's talk about this question. Let me know if this question was present. Better let me know. Some of the students said, sir, this was present. Some said this was not present. So let me know if this was present. That a chronic alcohol abuser is brought to the hospital with complaints of chronic liver disease. Which of the following would you add in the treatment? Was such kind of a question mentioned, beta? We know, no, this was not there. So it was, so some are saying yes. So even if it was there, we know the answer would have, okay, so this was not there. Even if it was there, we know that thiamine is one of the important treatment which we add, right? So yes, it was not there. So let me move to the next question. Let me know if this question was present. A child with low IQ, poor communication, presented with loss of bladder, urinary incontinence, which of the following is the most likely diagnosis? But tell me, was this question present? Again, we have been talking about this, autism spectrum disorder. Let me know. But again, will not say it is teenage rebellion. The symptoms are appearing to be more severe. Okay, there is a lot of impairment, so we may not consider it under the normal range. Again, recent drug use could have been one of the answers. Yes, it was there. Okay, let me know what were the options. So what answer I could gather from the student was, it was more pointing towards Heller syndrome. Let me know. Something similar was there. Okay, so I'll just read this question. Okay, let me know. Even after this session also, whenever you remember, you can just write down below in the comment section any changes you feel were there in any of these questions. In fact, we'll take up all those, suggestions, and then finally the questions would be put up in the app. Okay, so Heller syndrome, let me just briefly discuss this. So Heller syndrome we have discussed under autism spectrum disorder. It is one of the disorders now considered under this autism spectrum disorder. So it also has the two core features, that is deficit in social communication, repeated pattern of behavior. And we learned that here up till 2 years there is normal development, and after that the abnormality starts. So there is marked regression in several areas like bowel and bladder, language, social or adaptive behavior, play and motor skills. Okay, and also many patients may also have mental retardation. Okay, so that was not a question of psychiatry. So I'll put a query here only, but if such a question is asked in the future, those students who will be appearing later on, they can have an idea, because sometimes they will ask some questions. It is again a autism spectrum disorder, it's an important topic. Okay, right, I hope this is clear. Yes, let me know if what was the question. One question I think we have left with LSD. Let me know if a question on LSD was there and what were the options. But this was the question, yeah, I have got different options and slightly different language. So this is the question I think which all of you are saying, okay, so bullying was also there. Okay, so I'll try to reframe this question, but from the options which I could gather, doesn't seem to be the normal behavior. One of the options, that is recent drug use, if that was there, it could be the answer. Again, they are giving you suggestion like the person is coming home late in the night. So all those things, there is deterioration in the academic performance also. So in LSD, again, if LSD question was there, one of the option was hallucinations. We've talked about this. In fact, this was asked previously also, that reflex hallucination, a person turns on the radio and he see colors in the air. This was again a PYQ of FMG exam, hallucination especially. We've talked about reflex hallucination. Reflex hallucination can occur. Okay. Right, so hallucination, yes, they can occur. Yes. Any other option was there, beta, in LSD question? So yes, it is a hallucinogen. It comes under the category of hallucinogen like PCP, like MDMA, lysergic acid diethylamide. So yes, hallucination can occur with LSD. Yes. So these were the questions beta which you could gather, and I hope majority of you were able to mark most of these questions correctly, right? So with this we would end the session. Again, any changes you would suggest, just put under the comment section, and I'll just try to improve the language of each of the question. Yes, yeah, this question, yes, we are getting. Personality disorder, I would not say to be the answer again, because the age is young and also the symptoms should be present for a longer time, right? So thank you so much. Thank you everyone. I hope it was good, and I hope that now the exam would be clear, you would be sorted for the results. So all the very best for the result, and in this time please spend time with your friends, family, do things which you were wishing to do since so long, but you have been preparing for the exam. So thank you so much and all the very best. May God bless you all.